Hello, I'm Dr. Chris Driscoll. I'm with Omaha Integrated Health. Today is my day off and I'm about ready to go run some errands. That's why I'm not really dressed the part, but I wanted to discuss, while I was thinking about it, a question that seems to come up a lot online and when patients call our office. And that question is, does our treatment hurt? So one of the things that we offer at our office is treatment for knee pain. Now that knee pain can come from many different sources, but the primary source that we deal with is arthritic pain. So as we age and as our body undergoes repetitive traumas through the years, whether it's jogging repetitively or a constant repetitive impact, one way or the other through sports or through just natural usage, going up and down stairs, falling, etc. What will happen with the joint as the time goes by is it will literally start to decay. That's what arthritis really is. So you start to get bone spurs in the joint, the cartilage starts to fade away, and the patients will start to feel grinding and popping in the knee, and it will start to hurt. Well, in order to alleviate that pain, we inject a substance called hyaluronic acid into the joint. Now, we can do an artificial injection where we are actually using artificial hyaluronic acid derived from rooster combs, or what's called the chicken shot or the rooster shot. Or what we really tend to use, what we use the most often, is a natural substance that tends to work better than the artificial stuff, and that is a natural hyaluronic acid. Now patients go, well, why are you injecting an acid in the joint? Well, hyaluronic acid is something that you have in your joint already. Every joint that's mobile in your body has hyaluronic acid in there, and that hyaluronic acid provides a slick environment for your bones to be able to move smoothly back and forth without any friction. It's very thick and it's very oil-like substance. As we age and we add those traumas up into the joint, those traumas tend to cause the cells, the cellular structure in the cartilage, to produce less and less hyaluronic acid, and the quality of that hyaluronic acid goes down. It starts to become more watery. Well, when we inject the hyaluronic acid, the cool thing about injecting it is it tends to kind of stimulate those cells that are there, that are left, to make more hyaluronic acid. So it starts the reproduction process. It kicks it in so that it produces more, but it also makes it so that it's better. It's almost like it reminds the cell how it used to produce it. So it produces a better quality hyaluronic acid so that you can have less friction in that joint. It makes the joint last longer. Well, it can also decrease the amount of pain that you feel in the joint. So it's a natural product. It's something your body already has, and we're just giving it back more, kind of taking it back years so that it will behave the way that it used to. So then the patient goes, well, does that hurt when I get that done? Well, I can't say that you absolutely feel no pain, but we've done all the steps that we can to alleviate that pain. We will spray what's called ethyl chloride on the outside of the skin, which will numb it. It will deaden that skin before we do the injection. And then once the injection occurs, we inject lidocaine into the joint to deaden it even further. And then we can inject the hyaluronic acid. This is a very pretty fast treatment so that patients can have it during their lunch break and be done before their lunch break is over. So it's very quick, it's very easy, it's pretty non-invasive, and it beats the heck out of surgery, and it will help postpone surgery, sometimes indefinitely, sometimes it'll just postpone it maybe a couple years. Don't know, don't care. We're going to postpone that as long as we possibly can. Surgery is not the route. We don't want you to have surgery. You don't want to have surgery. Surgery has a 75